Endometriosis affects approximately 10% of women and those assigned female at birth, yet remains one of the least understood and most misdiagnosed conditions. What exactly is endometriosis? Why does it cause such intense pain? And what are the new discoveries that might finally bring relief to millions? Endometriosis occurs when tissue similar to the lining of the uterus, called the endometrium, starts growing outside the uterus. It can affect the ovaries, fallopian tubes, the outer surface of the uterus, and even the intestines or bladder. This tissue responds to hormonal changes, just like the uterine lining, thickening and breaking down with each menstrual cycle. But because it's outside the uterus, it has no way to exit the body. This causes inflammation, scar tissue, and adhesions, where organs stick together, leading to chronic pain, heavy periods, and even infertility in many cases. Despite being so common, it often takes years for women to be diagnosed due to its complex symptoms and limited awareness. Research, including recent findings from Nature, reveals that endometriosis pain is not simply due to the physical presence of tissue growths. The condition is also associated with inflammation and even nerve growth around the affected areas, which makes the pain even more intense and difficult to manage. Endometriosis creates its own network of nerve fibers, making these areas especially sensitive to pain. This pain can occur even in areas like the back, legs, and digestive tract, leading to misdiagnosis as other conditions. Diagnosis for endometriosis often requires a laparoscopy, a type of surgery that allows doctors to look inside the abdomen. Unfortunately, there is currently no non-invasive diagnostic test. Many patients are misdiagnosed with other conditions, like irritable bowel syndrome, before finally receiving a correct diagnosis. This delay in diagnosis is not only frustrating, but can lead to a worsening of symptoms. Early detection could help, but with current technology, this remains challenging. This delay in diagnosis is not only frustrating, but can lead to a worsening of symptoms. Early detection could help, but with current technology, this remains challenging. Recent studies have uncovered that endometriosis cells are genetically distinct from normal uterine cells. This discovery is helping scientists understand why endometrial tissue grows outside the uterus and behaves aggressively, unlike typical uterine lining cells. The article from Nature highlights how scientists are investigating these genetic differences to develop targeted treatments that could disrupt the abnormal growth of endometriosis tissue without affecting the rest of the body. Currently, treatments include pain management, hormone therapy, and sometimes surgery to remove the growths. However, these solutions are often temporary, and symptoms can return. Exciting research from recent studies is now exploring the potential of personalized medicine, treatments that target endometriosis at the molecular level. This could mean more effective, longer-lasting relief for those affected. Scientists are also looking at ways to block nerve growth or reduce inflammation in specific areas, which could help manage the intense pain that's so common in endometriosis. Endometriosis research is moving forward, but there's still much to learn. By bringing awareness to the condition and encouraging more research, there's hope that new therapies will emerge. If you or someone you know suffers from endometriosis, remember that you're not alone, and ongoing research is working to make a difference. Together, we can bring an end to the silent suffering caused by endometriosis and look forward to a future with more understanding, better treatments, and perhaps one day, a cure. Thank you for watching. Please let us know in the comments below which topic you would like to learn more about.